Hi, my name is Jenny. I will be demonstrating a video on doing an assessment on a client with a chest tube. I'm ready to enter my patient's room. Wash my hands. Hello, my name is Jenny. I will be your student nurse today. Can I have you please tell me your full name and date of birth? She tells me Jennifer Doe, 11/5/1975. All right, Jennifer, I'm here because I want to do an assessment of your chest tube, make sure your dressing's intact, making sure if that needs to be changed, I can change it at this time. Are you in any pain right now? And she says no. I came by and I administered some pain medication prior to coming to do this assessment. And Jennifer, I'm going to go ahead and I'm just going to check your vital signs. Once I check those, I'm paying close attention to respiratory rate, oxygen saturation, and then I'm also kind of assessing my patient at the moment, seeing her respiratory effort. I notice that she is not having any labored breathing right now. I don't notice any cyanosis, no pursed lip breathing. I'm not noticing any abdominal breathing. That would only be normal from birth to 2 years of age. Are you having a cough at all? She tells me no, she does not have a cough at all. I will also I will be listening to your lung sounds. Before doing that, I just want to ask you, are you having any discomfort at rest right now? She says no. How about when you're up with activity? She says a little bit. So I do want to encourage you to change positions every 2 hours, get up and ambulate if you're able to. And it's also really important to use your incentive spirometer every hour while you're awake if you're able to. I'll do my best to stay on top of your medications to make sure you're comfortable so you can cough and deep breathe. It's really good for the lungs if you do that. All right, Jennifer, I'm going to go ahead and listen to your lung sounds. So I'm going to have you take a nice full deep breath if you're able to for each time you feel my stethoscope move. Ideally, I would do the skin to stethoscope, but in this case I'll do on top here. All right, so I'm going to go ahead and take a listen. I'll have you lean forward. Okay, and I would make sure to make note if there were any adventitious breath sounds, and I did not notice any. Okay, so another thing to make note of is when your patient has a chest tube, it's important to have extra occlusive dressing supplies at the bedside, some normal saline, sterile water, hemostat. So I'm going to go ahead and move on to assessing the chest tube, the dressing. I'm just going to expose your chest tube here. That's what I need to look at. Okay, and I'm assessing the dressing. I'm assessing for any saturation or seeing if it needs to be changed at all. So what I'm going to do next is I'm going to palpate around the insertion site, working my way out. I'm feeling for any crepitus or any subcutaneous emphysema. So I'm going to slowly start kind of palpating around. And you might hear a popping noise, or it might feel like Rice Krispies under the fingertips, kind of popping and crackling. Okay. I didn't notice any crepitus, but if I did notice any, I would make sure to outline it so we can further assess in case it progressed and got any worse. In that case, you'd want to notify the provider. And so as I'm assessing her site. It looks intact. I'm going to follow the chest tube with the tubing down. I'm assessing, make sure all attachments are secured and in place, making sure there's no dependent loops at all in the tubing system. And as I follow it down, I'm making sure everything's attached, making sure it's not clamped. And I'm assessing my chamber, my drainage system, making sure it's the appropriate pressure in here, and it's set at -20. And I'll assess my water chamber, make sure there's 2 centimeters of water in there, or distilled water, and there is, but if there wasn't, I have my saline, normal saline at the bedside if I needed to refill it. I also want to assess my collection chambers. I'm assessing the amount. If I notice that it was draining excessively, more than 100 mils per hour, I would want to notify the provider, as well as if I notice any bright red fluids in there that could indicate fresh bleeding, I'd want to notify the provider immediately as well. I'm just observing for any characteristics, the amount. So as I'm assessing the tubing, I'm assessing for patency, integrity, and if there is an order for suction, I'm making sure that's attached appropriately. And I will follow the suction up, and I will check and see if it's set at the prescribed suction rate, and it is. Important thing to note is chest tubes should always remain below the level of the chest. They should remain upright, as so. And everything looks good, everything looks intact. I would also, after this, I would want to document the chest tube drainage, the characteristics, the amount, if the patient complained of any difficulty breathing, shortness of breath, vital signs, how the dressing looked, if it were intact or if it were soiled. I would document COCA and RITA, how the patient's tolerating it, what their activity's like, if they're using their IS, if they're coughing and deep breathing. And I'm just going to cover up my patient now since I'm done assessing that. I'll remove my gloves. Just going to wash my hands. I'll make sure the bed's low, call lights within reach. I'll make sure that she's comfortable. I also have her positioned in a semi-Fowler's position. That's to encourage drainage of the chest tube. And I think that concludes my video. Thank you.